morning centers, good morning everybody. Monday morning, cold morning, good morning. How is the cold over there? Okay, fine. Finally, Delhi is also under the cold stroke. So from today, yesterday onwards only, it was very chilly in fact. And today it's very cold. Okay. So how many students have turned up at each centers? Good morning, Tamil. How is the winter over there? Yes, children. Shillong, Tamil, Itanagar, and other center, who is it? Chuachandpur or Senapati? Yes, good morning. How is the cold over there? So cold, yes. Same pinch. It's so very cold. Okay, fine. So, did you appear for a test on Saturday? Orange Festival is going on. What is this Orange Festival? Tamil Nadu? Sounds interesting. What is this Orange Festival? Navam? Yes, Navam. Tell me, what is Orange Festival? And I guess the rest of the centers, they are getting prepared for the Christmas. Isn't it, Shillong? How is your Christmas preparation? Itanagar. Yes. Okay. So, shall we continue? Did you appear for a test? Coming back to main topic. Did you appear for a test? Biomolecules, how was it? No, you didn't? No? Why? The reason being, orange grower compete for best orange. Oh wow. That means Tamil Nadu must be very good at this agriculture, horticulture better. Not able to hear me properly? Just let me know if you are now able to. Are you able to hear now properly, Shillong? No one came for test. Is it okay? Can you now hear me, Shillong? Okay. Okay, fine. No one came here for test. I guess because of that all agitations going on in Northeast. Is it? Might be. Okay. So we'll continue. We will talk about, okay, no issues. You just coordinate with your coordinator. You can just have the things done in a better way again. No issues. Yes, curfew. I know there's like disturbance going on, agitations going over all in India. Because of that, yesterday Delhi also was a part of that. Today also, there are many metro stations in Delhi closed because of those agitations for security reasons. Yes, no problem. Let's continue. Let's talk about our main topic, what we are here for. So, things will go on like this only. We have to continue our NEET preparations. So, last class we talked about cancer, isn't it? We talked about AIDS, we talked about cancer. And I was supposedly going to end your topic by Tuesday, but because of unforeseen circumstances, we did not have our class. So we will continue with the drugs and alcohol abuse topic today, and we'll try and finish it today itself. Yes. Do we have any doubts on the previous topics? Yes, centers, tell me please. Tamil, Shillong, Chuachandpur, Senapati, Itanagar. No doubts? No doubts? Okay, fine. Very good. You people are so good. I wish I could be a student like you. Huh? No doubts. Always no doubts. Okay, fine. So there are two things our teacher used to tell when we always used to say that we don't have any doubts. Either the things are very clear or they are not clear at all. And one more thing my teacher used to say, या तो मैं बहुत अच्छा पढ़ा रहा हूँ या तो बिल्कुल ही बुरा पढ़ा रहा हूँ. So I guess we learn many things from our teachers. So मुझे भी लग रहा है कि या तो बहुत अच्छा पढ़ा रही हूँ या तो फिर बहुत ही बुरा पढ़ा रही हूँ. Okay, jokes apart. Continue. Drugs and alcohol abuse. Yes. So what are drugs? Anybody? What are drugs? You can see 5 centers online today. Yes. Good morning, everybody. Yes. What are drugs? Any idea about drugs? Drugs are available on the medicine stores also, on the chemist shop also. But here we will be talking about those drugs which are addictive in some or other forms, and in your syllabus you will talk about some of them which are totally banned for their uses. So apart from a few drugs, they all are addictive. We will see the non-addictive ones also, and obviously we will see about the side effects of alcohol, because alcohol is also addictive in nature. So first of all, why we are doing this chapter, why we are doing this topic in this chapter, because this is something which is actually very, very effective, or the youth population is thought to be very, very under these effects. So it's a common thing. I don't know about all parts of India, but in some parts of our country, in world also, drug abuse is a very, very serious issue, and that all starts when we are a teenager, when we are in our adolescence. So in adolescence, what we have to do, we have to be very much aware about these topics, that we have to be not under the addictive effect of drugs, not under the addictive effect of alcohol, and prepare ourselves in such a way that we are escaping these kinds of social pressure. So we'll just talk about the drugs abused. So when you talk about the drugs abused, what you have to do is you have to clarify under 3 headings: opioids, cannabinoids, coca alkaloids, and cocaine. So we have 3 different types of drugs that are thought to be and are found to be very, very abusive on our health: opioids, cannabinoids, coca alkaloids, or cocaine. One by one we are going to see all of them. Let us start up from the opioids. So what are opioids? The examples we'll talk about first of all, because I guess the examples are more popular. That's why I will talk about examples first of all. Morphine and heroin, isn't it? Morphine and heroin both are the examples of opioids, and these opioids are, what are these opioids? These opioids are the drugs which bind to specific opioid receptors present in CNS plus gastrointestinal tract. So you have certain receptors on which they are going to bind, and these receptors are present where? These receptors are present on your central nervous system, that is your brain and spinal cord. My God, what is going on? What is this? Yes. So these receptors are present on CNS and your gastrointestinal tract, that is particular part of your alimentary canal through which the food passes through. So you have 2 different sites at which the opioid receptors are present, that is CNS. Keep on highlighting things, keep on writing things with a different color pen or highlighter to just highlight things which I am highlighting on my notes. Okay, just keep on doing that. That's quite important. So examples are obviously very, very important. So opioid receptors, they bind to CNS and GIT receptors, and what effect they bring about. So first of all, talk about heroin. So heroin is also called as smack, and if you talk about its chemical form, that is in the language of Subesa, it's diacetyl morphine. So this diacetyl morphine or heroin or smack is a white colored, this is odorless, this is bitter, this is crystalline, compound, chemical nature. How people abuse it? First of all, let's see how it is prepared. This is obtained by acetylation of morphine this is latex of poppy plant, and the botanical name for poppy plant is Papaver somniferum. Papaver somniferum is what? It is poppy plant, and this poppy plant is actually used its latex is actually used in formation of morphine and heroin. So first of all, you have to obtain morphine, and then what we do is that we acetylate it, that is we add acetyl groups to morphine to form heroin. Yes, any problem? Any confusion? Yes, Shulong? 1, 2, 3, 4, 5, 6. Okay. Did you send your attendance on the LMS? Have you? All of you. All the centers, please. Just write about how many students are there on each centers. Okay, fine. So Papaver somniferum is a source of poppy plant, source of morphine, and when you acetylate it, when you add acetyl group to morphine, they turn to form heroin. Okay. Now let's see how people use it, or how they not actually use it, sorry. They abuse it. So how they abuse it? They are often snorted or in the form of injection, that is intravenous. That is, they will be using their veins. You must have seen drug addicts. They use their veins to just have the injection in their veins. So this is snorted, or this can be injected. So why do people take it? There must be something good about it. Is it something good about it or bad about it? Yes, any idea? Why do people take it? It's good or bad? If it is good, let's all take it. Is it? So first of all, let's see its effects. What is heroin doing to our system? Anybody? No one? Why is it good? It's a depressant plus it slows down the body functions. So it will make you actually feel very relaxed, isn't it? It's going to make the person, the addict, very relaxed. But obviously this relaxation is not good because it is addictive in nature. But yes, they are used for some betterment also. Like morphine is used as a sedative. What is sedative? Those drugs which have sleep inducing effect, they are called as sedative. They are sleep inducers. They will make you feel sleepy. Plus painkiller. So these drugs are actually sometimes drugs or heroin or morphine, they are many times used post surgery. That is, after surgery they are used. Why? Because the patient needs some rest, the patient needs relief from pain, the pain of the surgery. So what doctors do? To induce sleep in them, because the more they sleep, the more they rest and they have more better systems. So what is done is basically they are given these injections so that they can have some rest. Obviously post surgery only it can be given, only post surgery. So you cannot use it in everyday life because the dosage and the frequency of use decides if it is addictive or not. So doctors, they know how much dosage you have to take, they know how much times a day you need to take, but we won't know. That is why we cannot use it on our own. So please don't try to. It's very, very risky. Done? Shall I proceed? Yes, Shillong, clear? Just give me a thumbs up. Okay, very good. Yes, everybody? Clear? So it's your Nitin sir's birthday today. You must have got that message on your groups, isn't it? Okay, fine. We'll talk about next drug, number B. I guess we have copied and we should move ahead with cannabinoids. So what are cannabinoids? Very easy to learn. Obviously, if it's cannabinoids, it is going to interact with cannabinoid receptors. As easy as that. But where are these cannabinoid receptors present? They are exclusively present in your brain. So the receptors of morphine, heroin, that is all the opioids, were present in the brain and spinal cord as well as GIT. Let's talk about examples first, as we did in the previous drug. So we have examples like marijuana, we have hashish, charas and ganja. Just highlight these examples because many times questions are directly asked from the examples. So we have marijuana, hashish, charas and ganja as the common cannabinoids which are having their receptors in your brain. So where do these cannabinoids are obtained from? Obtained from the plant inflorescence of, you know what is inflorescence, I must have taught you what is inflorescence, from the inflorescence of cannabis sativa. Fine. We'll talk about mode of intake. Mode of intake is inhalation and oral ingestion. Effects. So the effect is on cardiovascular system. So these drugs are known to have a very abusive effects on the sports people. So obviously if you talk about the cardiovascular system, obviously it is going to increase the things, whatever the things you have from the cardiovascular system, they are going to put on increased effects. That is, the heart rate will increase, the blood pressure will increase, the flow of blood rate to different organs including the limbs will increase. So this gives a boost to the cardiovascular system, and that is why the sports people, they abuse it, so that they can run faster, they can use their stamina for a comparatively longer time without drugs compared to without drugs. Clear? Sorted? Shall I move ahead? Third category, can we talk about? Shillong. Clear? So how is your Christmas preparation going on? How many of you are excited for Christmas? No one? Yes, other centers. Tamilnad, Itanagar, Shillong, I guess Chuachandpur is also online today. Senapati. Yes, Tamilnad is busy in Orange Festival. Okay. Yes, children. How is your Christmas preparation going on? No preparations? Shillong? Nothing? Nothing going on? Serious about NEET, we don't want to have any celebrations this year. Is it like that? Okay, I don't think so. It should be like that. You should have like on the same day itself, not a week ahead, but you should celebrate all the festivals. Okay. So we have third drug category, coca alkaloids and cocaine. So coca alkaloids and cocaine, if you talk about coca alkaloids and cocaine, the only examples what we have in our mind is actually cocaine itself, and apart from cocaine, we call it to be coke or crack, so C-R-A-C-K. So smack was different. Smack was heroin and crack is cocaine. Smack and crack, there are two different categories of drugs. So coke or crack or cocaine. So what is this? Basically, let's talk about obtained from cocoa plant, Erythroxylum cocoa. And this is native to which part of the world? To South America. What does it do? This interferes with transport of a very important neurotransmitter called as dopamine. We have studied about dopamine in our central nervous system when I was teaching you CNS section. So we talked about dopamine over there also. This is a particular neurotransmitter which gives you a feel-good feeling. So the more dopamine you have in your system, the more happy you feel. So this actually interferes with the transport of dopamine. How? What it does is, this produces a sense of euphoria. What is euphoria? Euphoria is feel good feeling. So can be like an example, with an example can be explained. There is somewhere there is a fire and you are relaxed, as cool as ice. So this gives a feeling of euphoria plus increased energy. So two effects of coca alkaloids or cocaine. Euphoria. So euphoria is a feel-good feeling, or you feel that after taking these drugs, I'm in a car and the car is flying in air, or I'm on a magic carpet and the carpet is in the air, I'm walking on water. So these are actually feel-good feelings, that is, you are actually able to sense those things which are not possible. So if a person, abuser, takes excessive of these drugs, in excess, this causes hallucination. You must be aware what is hallucination. So hallucination is basically a kind of thing that is, you are able to see things which are not actually possible or not actually happening. We have other hallucination properties in plants. Just mention a note over here. Atropa belladonna plus datura. So other hallucinogens apart from coca alkaloids, they can be obtained from plants like Atropa belladonna and datura. This was note 1. Note 2. There are certain drugs like barbiturates, amphetamines, benzodiazepine, they help in dealing with diseases, mental disorders like depression and insomnia. So when you become a doctor, so if you have patients who have depression, who have insomnia, insomnia is sleeplessness. That is, the patient will complain that they are not having proper sleep. So you can use these drugs, obviously, you will know the dosage and everything, you will taught about that, and you can use those for treating them. But yes, see, they are abused also. So as I started the chapter, the dosage and frequency decides. Two things will decide that they are abused or not. Dosage plus frequency. How many times you are taking that drug and in what dosage you are taking it. So dosage plus frequency decides if a drug is abused. So repeated dosage obviously shows more of abuse. So this is going to impair or affect anybody's physiological, psychological, and physical functions. So in this way, these drugs are very, very addictive. Yes, clear everybody? Just tell me, we're done with the drugs part. Is there anything which is left to discuss? Or anything which is not clear? Yes, please children. Shillong? All sorted? Sorted? Tamilong, Itanagar, Senapati, Chuachandpur. Is everything clear? Tell me. Other centers. Shillong is very busy today, huh? Shillong, what are you busy with? Very, very busy. Itanagar, Senapati, Chuachandpur. Shillong, just give me a thumbs up if it's clear. You people are so cold today. Huh? The weather is also cold and you are also cold. Yes. Yes, very good. Yes. So show some enthusiasm to your teacher. Otherwise I will sleep. I will go to sleep. Is it? Fine. So we will start with a new, yes, show me some enthusiasm, otherwise I will sleep, exactly. I will go to sleep. Fine. Okay. So this is sorted, I guess. So what is the period of adolescence? Tell me. Are you adults or adolescents now? What's the age group of adolescents? We have all been through that, and you are actually going through that, in fact. What's the time period of adolescence? Oh, wow. Very good, Tamalong. Exact. Yes. Rest of the centers, tell me. What is the age group of adolescents? When you get confused that how should I behave? Should I behave like an adult or shall I behave like a child? Parents will sometimes say that you are grown up, don't behave like this. And sometimes they will tell you, okay, you keep quiet, you are a child. You are still a child. Is it? It must have happened with you also, I guess. No, Shillong. That's still in childhood. It's 12 to 18, exactly. 12 to 18 years of age, yes, can be. 13 plus can be said to be. Above, not above, up to 18, yes, up to 18. I'm not an adolescent now. Okay, fine. So, this is basically an age group where people generally are easily influenced by others, is it? Are you? Are you influenced by others? Centers? Tell me yes or no. Yes, it is thought to be, and that is why you have a topic in your book that says all about it, that is adolescence and drug or alcohol abuse. So, this is kind of issue which is more thought to be more easily picked up by adolescent, that is a particular age group between 12 to 18 years. This is the adolescent age group, 12 to 18 years. So, this is a particular age group where you have a bridge, you have a link between your childhood and your adulthood. So, on one side you are sometimes told by your parents that you act smart, act wise, you are not a child now, and on the other side you are asked, you keep quiet, you are still a child, we don't need your opinion in this topic, isn't it? So, this is basically an age group where we have many types of drug abuses, we have many types of alcohol abuses getting into society. So, what are the reasons of it? Let us see quickly. Since we all are very, very smart, we are all very wise, we know it, but still, the first reason is curiosity, isn't it? Experimentation, excitement. So, excitement plus the way you want to do experiments. Let's try, let's have it, isn't it? So, this is one of the most important reason that drives the adolescent children or adolescents towards these kind of abusive nature. So, it starts with curiosity, ends up with problem, because after curiosity, the addictiveness, when we have stress or pressure to excel in academics. To escape the pressure, sometimes the children, they start so sometimes the children also think that it looks cool, isn't it? With a cigarette in hand, in between your fingers, it looks very cool, it looks very it looks very fashionable. That is one of the most important reason. They want to impress others. Next, we have some ads, some movies on the televisions where the hero or heroine we see with cigarette and alcohol. So many times we feel that, okay, if he can have it, if Shah Rukh is having, why shouldn't I also? Isn't it? This kind of things. So television, movie, newspaper, internet promotes this perception. So these are some of the reasons why anybody would like to do drug or alcohol abuse. And yes, one more thing which is actually a serious cause, unstable family. So unstable family, they try to escape those kinds of problems by abusing drug and alcohol. So once people start to, or the child or adolescent or anybody starts to take alcohol or drugs, they become addictive. So how would you define addictive? Addictive is, or addiction. This is a psychological attachment to certain effects like euphoria, and feeling of well-being. And gradually addiction causes dependence. So what is dependence? Tendency of the body to manifest a withdrawal syndrome. The person feels some kind of attachment to a drug, that if the drug is supposedly taken back, they have certain types of feelings in their body, which is given a term called as withdrawal syndrome. And what is this withdrawal syndrome? This is characterized by the person, or the abuser will show you anxiety, show you shakiness, nausea, and sweating. So if they again start to reuse the drug, they will actually get rid of these particular symptoms. So it's like many symptoms combined together and given a term called as syndrome, and this is thought to be withdrawal syndrome. So if a drug abuser or addict is not given drugs to abuse, they will show you anxiety, shakiness, nausea, and sweating. This can be very sometimes very at a high level also, that the person can become physically dependent, and they can hit the person, hit others, and damage things, physical kind of power they can show. So this depends on drugs to drugs, what kind of effect they are going to show. Yes, sorted? Clear? Shall I move ahead? I'll talk about next thing. So effects of abusing, effects of drugs or alcohol abuse. So first and foremost thing, what they actually have, if the drug is taken intravenously, they pose a threat on spreading some very serious diseases like AIDS and hepatitis B. That is basically because of sharing of same needle to abuse the drug. So they are very much potential to have. So drug abusers, they can communicate AIDS among them by sharing the same needle, sharing the same injection. So they share needles, and because of that sharing, they can, or they are more prone to any kind of diseases like STDs also. Alcohol. Let's see what alcohol can do. Long-term alcohol abuse causes liver cirrhosis. So when the abuser is taking alcohol for a long term, what they cause is, they cause liver cirrhosis in the patient, in the abuser. Let's see what sports people do. They abuse drugs to enhance their performance. And the most abused drugs fall into category of narcotics, analgesic. They fall in the category of narcotic analgesic, anabolic steroids, diuretics, and certain hormones. So these are things which are actually abused by sports people. Narcotic analgesics, anabolic steroids. So we do have dope tests. You must have heard about it, doping. So we do perform dope tests before any event, before any athletic event or before any kind of event, just to check that if the person has abused any of these drugs. So is it good or bad? So why do they take it? Because this increases their athletic performance, plus the aggressiveness. they will turn out to be more better in their performance, as well as more aggressive to attain their performance. So do they have any side effects? What do you say? Is it good to take these particular drugs by the sports people? Is it okay? Or can you talk about some side effects these drugs are posing on these athletes? Yes. Do they? Do they pose a side effect? What do you say? Did you copy? Shillong? Itanagar, Tamilong, Senapati, Chuachampur. Did you copy? Ah. Yes. I guess you have. Okay, fine, very good. So let's talk about side effects. So side effects will be a bit different in males and females, because these drugs are, we talked about hormones also, see hormones also, hormones and anabolic steroids. So these steroids and anabolic steroids, diuretics, they have different side effects on males and females. You talk about, okay, no issues, Itanagar, no problem. So in females, let's see first the problems. The first thing is there will be masculinization. As a female will appear like a male. Masculinization, that is features like males. Then we have is obviously increased aggressiveness. We find the female to be more aggressive, because more aggressiveness is not a criteria or not a characteristic of female, it is a characteristic of testosterone hormone that is more in males compared to females. So the females are thought to be less aggressive compared to males. That's why you will notice that all your primary school teachers are generally females, 99.9%. Then we have is mood swings. These all are hormonal problems. We have mood swings. Then yes, obviously depression, which is very, very common these days. The female will also have abnormal menstrual cycle, obviously because of the anabolic steroids. Excessive hair growth on face. Plus body and enlargement of clitoris is because of more hormones, obviously. Deepening of voice. So these are some of the features that a female is showing whenever they are on drug abuse. Obviously the females, sports people, we're talking about side effects of anabolic steroids, of diuretics, all those things, hormones. Let's talk about males, what thing males will be having. The first and foremost thing, there will be acne and increased aggressiveness. Obviously mood swings will be also in males. There is mood swings. Then depression, yes. Reduced size of testicles. Decreased sperm production. Kidney plus liver dysfunction. That is, they might show a decreased activity compared to a normal male. There will be breast enlargement seen in males. And premature baldness. Another important thing, enlargement of prostate gland, and these effects can be reversible, but if the drugs are taken for a very long time, there will be irreversible changes and these will become permanent. So quite serious. If you talk about these things, they are quite serious, and this indicates that there should not be drug abuse. Yes, sorted centers, Shillong, Itanagar, Tamilong, Senapati, sorted with everything. Yes, you have to go through these things when you are appearing for NEET, because these might be questions in the form of statement, and they will be giving you a set of statements and they will ask which of the following is not a side effect of drug abuse. Questions can this be asked in exam. Yes. If you have copied, can we have a small break? Only if you have copied everything. Yes? Okay, fine. So we will have a small break, 5 to 7 minutes. We resume with how to deal with abuse problems, prevention and control. Fine. Please take a small break. Yes. Where are your friends? Call them. Yes. Fine. Okay. So we'll talk about, things are clear up till now. We'll talk about now. Senapati, Itanagar, Tamilnong, all present? Chuachampur? Everybody is here. Yes. Shillong. Okay. So, we'll talk about, we have talked about what? We have talked about the things what actually side effects count as. Side effects are what? The effects of prolonged drug abuse in, especially we talked about the sports people. So, it always seems to be a very, very, you can say, shortcut method, but if the dependence increases, especially in sports people, they are going to pose a very serious threat. And we talked about those threats, those particular changes. Yes, those changes are very serious and they are permanent. If the abuse is for a very long time, these changes are going to be permanent. So, beware of these things, beware of drugs, beware of its abusing properties. If used as medicine, it is okay, but that we cannot decide. We have to consult a specialist about it, how to deal with the problems, and obviously we talk about prevention and control. So, what can be the prevention and control steps from your side? Can you suggest me? Prevention and control, obviously, of drug abuse. So, how can you prevent? You know, prevention is better than cure, isn't it? It's an age-old saying. Prevention is better than cure. So, depending on that, we have to study now. Not me. I know prevention is better than cure. You people have to know about these things. The first prevention and control, what seems to be very, very handy is avoid undue pressure. So, if you find somebody who is actually pressurizing you to try these drugs, you have to say them no, clear no. So, avoid undue pressure, obviously from peer, isn't it? Peer means the people who are along with you, the classmates, friends, everybody. So, you have to say them, you have to learn to say no. If they are offering you drugs, let's try once. You will feel very good, you will feel very excited. Second thing what we can talk about is education and counseling. So, this is actually not for you only. If you come across any of your friends having these problems, you can try to take them to a counselor. Then obviously parents, the first people to get help from, and obviously some good friends. So, you can ask for help from your parents as well as peers, and looking for danger signs. So, if I see my friend, any of my friend who is showing some danger signs, who is showing some different kind of symptoms, that is to be noticed and they are to be counseled. What kind of symptoms they would show? What kind of symptoms they would show? That is, hygiene will be very low in those people, academics will be actually very different, body loss, loss of appetite, body weight, loss of appetite. These are some of the symptoms which a person having drug abuse for a very long time is going to show. And obviously, you have to go for professional and medical help. So, you have to sort out things in this way that we have to prevent the problems of drug abuse in the people nearby us. Fine. Talk about smoking. So, what is smoking? Tobacco smoke. Basically, we are talking about Tobacco smoking, precisely. So tobacco is like used, or you can say it has been into human culture since like 400 years. It's used since 400 years. And how can we do it? Use it, sorry. It can be smoked, it can be chewed, or it can be snuffed. What is snuffing? Yes, what is snuff? Anybody? What is snuffing, children? What is snuffing? No idea. What is snuffing? No? Okay, I will just try and find out a small image or something like that will show you snuffing. What is snuffing? Yes, you can just refer to, I have sent you an image of snuffing. Did you see it? Everybody? So this is snuffing. So in this way, people actually use tobacco. Okay, they can be chewed, that is directly, it can be ingested, or it can be snuffed through the root of the nasal chamber. So what is tobacco actually having? Tobacco has a lots of chemicals. It has many chemicals, and the most important of them is nicotine. This nicotine happens to be an alkaloid, and this is basically known to stimulate adrenal gland, and when stimulate the adrenal gland, they release adrenaline. I have taught you what is adrenaline. That is an emergency hormone. So this adrenaline has a sympathetic effect on your body. Okay, and you know what is sympathetic effect. That includes what? This includes increased blood pressure, increased heartbeat, so the person actually feels energetic. So if you talk to a tobacco abuser, he or she will say that it makes me feel energetic. So this is that gives an impression of energy. Feels energetic. The person feels energetic. But however, when it is smoked, when talk about smoking tobacco, it has many side effects. However, increased blood pressure is also not good thing, because always if blood pressure is high, there will be more of cardiovascular problems. So these things also increases the chances of cardiovascular or heart diseases. So what kind of side effects they have? They are very much prone to lung cancer. I have taught you all these things. I talk about not only lung cancer, but they are also very much prone to urinary bladder cancer, they are having throat cancer, chances of. Bronchitis, that is infection of the bronchioles. Emphysema. Now, emphysema is a disease where the capacity of the alveoli to exchange gases decreases. I have taught you this also in breathing exchange of gases. Emphysema, bronchitis, and not only this, but they are prone to coronary heart diseases. Means blockage in the vessels which are supplying blood to your heart, that can also get blocked. And if the patient is, or the person is having a very, very high addictive effect, that they are having empty stomach also, they can smoke, it is also going to cause gastric ulcer. This is when smoked. When chewed, this can cause oral cancer. So in no ways I find tobacco to be a kind of thing which can be promoted in any ways. So obviously same thing must be with you people also. It's a cause, it's a reason of n number of diseases which are life threatening. These all are life threatening diseases. So you must be you must have seen on the packets of cigarettes there is a warning. Tobacco smoking is injurious to health. Got it? Clear? Now, one more thing, you just make a note of it. Smoking tobacco increases the level of carbon monoxide in the body. Now you know what is carbon monoxide doing to our system. When you have more of carbon monoxide, hemoglobin is going to bind to carbon monoxide instead of oxygen because of its high affinity. So this is going to have a side effect or have an effect on decreased oxygen carrying capacity of hemoglobin. So hemoglobin is going to show a decreased oxygen carrying capacity, and obviously you know what is going to happen as a result of it. This person is going to suffer from anemia, isn't it? So it's a kind of anemia where oxygen is present, comparatively iron is present, but iron is not able to bind to oxygen because of presence of carbon monoxide. Yes. So can we do some questions if the chapter is clear to everybody? Can we have some questions? And if any doubt you have, you can talk about the doubts also. Everybody, all the centers. What is analgesic? What is antibiotic? What is antipyretic? You people are going to become doctor. What is? Tell me, what is antibiotic? What is analgesic? What is antipyretic? What are these? Antibiotic, antipyretic, anti-analgesic. No idea? Yes. What are these? Tell me, children. Senapati, Itanagar, Tamenlong, Chuachampur, Shillong. Huh? What's antibiotic? Antibiotic. Anti means against, biotic means life. So they are actually against life, means obviously against microorganisms. Yes, exactly, antimicrobial. Very good, Itanagar. So if you're taking, if somebody is having, suppose throat infection, obviously that throat infection must be because of some bacteria. So if you are taking diseases to cure that throat infection, that would be an antibiotic. Analgesic, analgesic is painkiller. Something which is used to take, like used to keep away pain, release from pain, like morphine is one of the examples, just now we did it. Antipyretic is something which is going to decrease fever, like example paracetamol. Paracetamol is an antipyretic. Okay? Okay, we'll do some questions. If in case we have any doubts, you can just discuss. First question. Chewing tobacco causes cancer of. First option. Oral, lung, urinary bladder, prostate cancer. Yes. Quick. Everybody, all the centers, I need answers from each and every center, please. good. Yes, Senapati. Tell me, children. Tamil Long. Easy question. Chua Champur. Answer me, please. If your chat is not working, you can answer on the group also. Suppose the answer is second, you have to write 1.2. If it is third, write 1.3. That is, question number 1 has third option correct. 1.3. Because I am going to give you some more questions. No issues, Itanagar. Question number 2. Which of the following is cannabinoid? First, morphine. Second, heroin. Codeine. Charas. Question number 2. Which of the following is a cannabinoid? Let's see third question. Keep on answering the way I have told you. Receptors of opioids are present in receptors of opioids are present in CNS, GIT, both A and B, or spleen. Question number 4. Which of the following drugs are abused by sports persons? First, opioid. Second, cannabinoid. Third, coca alkaloid. Fourth, nicotine. Everybody done up to 3? Please do fourth question. This saying called as don't die of ignorance is set for cancer, AIDS, malaria, filaria. Done. Fourth question is done. Sort out fifth. In the meantime, we'll have one more question, last question. AIDS is characterized by decrease in mast cells, neutrophils, RBC, and last is helper T cells. Okay, sorted everybody, all the questions. Do you want me to scroll up for any of the questions? Please let me know. Don't sleep, Shillong. Yes, get up. Yes, the boy on the first bench. Don't sleep. Get up, get up. Yes. I will also sleep otherwise. Sorted? Answer all the questions. Up to 6 number. Everybody. All of you. Did you answer all? 6 is yet to be answered by any of the centers. Please answer sixth question also. Quickly. Yes, Tamilong, Itanagar, Shillong, Senapati, Chuachampur. Quick answer, please. Very good. Your Tamilong is very energetic. Very good, Tamilong. Just let's. Yes, Itanagar, your answer. Senapati did not answer any question. What is happening, child? Is there some problem? Okay, so chewing tobacco causes cancer of. Just cross check your answer and let me know how many of your answers are correct, honestly. So obviously chewing tobacco causes cancer of oral cancer. Just now we did this thing. You can just go ahead and find in your notes also just now. See, by chewing tobacco there is oral cancer chances in the person. Next question, which of the following is a cannabinoid? Yes, charas is a cannabinoid. Morphine, heroin, codeine, they are all opioids. Receptors of opioids are present in both CNS and GIT. Third option is correct. Which of the following drugs are abused by sports people? Obviously cannabinoids, because cannabinoids are going to increase the cardiovascular activity. So opioid is going to decrease it, coca alkaloid is going to decrease it. In fact, coca alkaloid will produce hallucinations also. So obviously the sports person will need to have more of energy, more of aggressiveness, and that is only and only given by cannabinoids. But yes, nicotine drugs, they are obviously drugs, but they are not falling into direct dope category drugs. Okay, so nicotine will not be considered over here. Don't die of ignorance and set for AIDS. This is old saying. This is an old saying which is used for AIDS. AIDS is characterized by decrease in, yes, obviously the helper T cells are the ones, or the macrophages. If it was not the option, it need to be macrophages. So helper T cells and macrophages are the targets of the AIDS virus. HIV virus, they target on these particular cells and obviously cause its destruction in long run. The incubation period can be up to 10 years. So a full blown HIV turns into AIDS for approximate a time period of, in approximate a time period of 10 years. Okay, Itanagar, very good. It's Luni at Itanagar, I guess. Very good. Fine. And what about others? How many answers are correct? Shillong? Okay, Nabam, sorry. Luni is a Tamil. Sometimes I get confused among your centers. Really sorry. Yes, Nabam, very good. Keep it up. Yes, Tamil, Luni, how many options are correct? Senapati? I guess chat is not working or there is some issue. Shillong? Okay, very good, Luni. 5 answers, not bad. Shillong, are you going to answer me today? How many answers did you answer correct? Huh? Everybody is so busy at Shillong today. All correct? Is it? Or one correct? What is this? One correct? Or all correct? Five. Okay, very good. Not bad. Oh, all correct. Okay, you should clap for yourself. Very good. Doing good, nice. Okay, and what about others? So this was precisely your chapter Human Health and Disease, long chapter, but yes, very, very important. Just try and do questions from these chapters and this chapter and let me know if you have any problem. Okay, we are still undergoing tests with 11th standard syllabus, and the next chapter I will be starting tomorrow is microbes in human welfare. Is it fine? Shall I start with microbes in human welfare tomorrow? Start with new chapter. In case you have any doubts, bring those doubts, we'll discuss them and we'll talk about a new chapter, microbes in human welfare. Please. Okay, fine. So I guess we should wrap up. Don't have any doubts? We should wrap up? Okay, fine. So let's see tomorrow a new chapter, microbes in human welfare, and please do get your doubts tomorrow. Any kind of problem, any kind of doubts from any of the chapters from 11th standard or up to now, whatever I have taught you in 12th, you can just come with those doubts. And yes, nice moves, very good. Okay, fine. Okay, take care, bye-bye. Have your lunch. Thank you so much. Bye.